How sterile are the medical instruments used at your local hospital? I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative Thomas Murt. Thanks so much for being with us.
Hi, Jill. Great to be here.
It's a concern when you check into a hospital for any procedure or operation. You're concerned about the cleanliness of the instruments that are actually being used. But you say there's not a set standard across the Commonwealth, but you're looking to change that with a piece of legislation.
That's correct, Jill. The Centers for Disease Prevention and Control have established standards for the sterilization of reusable medical instruments. However, the absence of a law in the Commonwealth of Pennsylvania really has created a situation where each hospital, each healthcare facility has established their own procedures for the sterilization of reusable medical instruments.
Now, for hospitals across the Commonwealth, though, are they taking precautions to work to ensure that these reusable medical devices and implements are actually sterile?
That's correct. We believe that our healthcare facilities and our hospitals and medical centers in the Commonwealth of Pennsylvania are doing a very good job. The legislation that has been proposed really establishes standards for the training of our central sterilization technicians relative to their training and to their continuing education requirements.
So have there been instances then where some of these devices, some of these implements have not been sterilized properly?
Well, that's sometimes that's a difficult question to answer because there are infection control is still a very serious concern and challenge for our hospitals across the nation. And incidents have happened, not always traceable back to an instrument that has not been sterilized properly, but also the infections are evolving worldwide that are resistant to certain medications and drugs and so forth. And we really believe that prevention and sterilization in a hospital-based setting is critically important. And the legislation that has been proposed by one of my colleagues in Harrisburg sets those standards. And frequently the technicians that work in sterilization are sometimes entry-level positions or positions that require minimal training. And we believe that this proposed legislation sets a standard and will require the technicians to have a certain level of training. But in addition to that, which is a very important part of this, there is a requirement for continuing education training, much like many other allied health and healthcare professions require.
Now, when we talk about this continued training for the individuals, for these technicians who would actually be doing the sterilization process, who would pay for it? Would it be the individual technicians? Would it be up to the healthcare systems? What kind of response are you getting from this legislation from the healthcare systems themselves related to potential costs associated with this bill?
That's a good question. The answer is the healthcare community has been supportive of this. They believe that this is in their best interest. To answer your specific question, the healthcare facility would be required for presenting that information to their employees. However, it would be up to the Commonwealth to establish what the continuing education requirements would be, whether it's training in new diseases or infections that have evolved, that have come from certain parts of the world, that have been resistant to antibiotics and so forth. And every industry, every profession continues to change, especially with the advent of technology and the use of technology. And certainly the healthcare industry is no different in that regard.
And we just have a short time left, but as it stands now, is each hospital or healthcare system setting its own standards for sterilization?
Excellent question. And the answer is they are required to set the procedures. The standards are actually done on a national basis from the Centers for Disease Prevention and Control, and then the hospitals will set the standards to comply.
Thanks so much for being with us.
Thank you, Jill.
We've been talking with Pennsylvania State Representative Thomas Murt. I'm Jill Horner for Comcast Newsmakers.